Well, welcome to today's talk, Saturday the 11th of December. A lot going on with Omicron at the moment, so I want to stay with that. Now, if you're in South Africa, you're being exposed to Omicron as we speak. If you're in the United Kingdom, you're going to be exposed to Omicron in the next few weeks. If you're in the United States, you're going to be exposed to Omicron in the next few weeks, or certainly month or so. The whole world, we believe now, is going to be exposed to this. Now, thankfully, so far, it's only making a small minority of people ill. But if lots of people get it all at the same time because it's so massively transmissible, a small proportion of a lot of people could still be a lot of people ending up needing to go to hospital all at the same time. And this is what we are worried about with Omicron. This is why we're watching South Africa so carefully. So on to South Africa, the R value is 2.5. So each infected person on average infecting 2.5 other people. This is giving us an exponential rate of growth. In the UK at the moment, the number of people with the Omicron variant is doubling every 2.5 days, according to most estimates. This is an incredible acceleration, which means soon everyone's going to be exposed to Omicron. Vaccinated, unvaccinated, everyone. This is just a raging infection now, but thankfully, so far, as we'll see, not making people very ill, just a very small proportion. And we're hoping it's going to stay that way. National Institute for Communicable Disease, that's their figure, R equals 2.5 in South Africa. Really quite incredible. The percentage of positive tests nationally, so the positivity. Now remember, the positivity is a good indication of the community prevalence at any one time. So the positivity nationally, it's 25%, 24.9%. And again, that's for the week ending the 4th of December. So that's already out of date, but it's the latest we've got. 16.4% higher than last week. So of all the tests being done, a quarter of them are coming back positive. This means there is a lot of Omicron in the population in South Africa at the moment. And as we say, everyone is being exposed as we speak. Now, it does vary quite a bit depending on the states. Gauteng, 35%, Limpopo, 32%. Other areas slightly less. Other areas even less. Free State, Western Cape, KwaZulu-Natal, 10 to 15%. Eastern Cape and Northern Cape, lower. But, of course, it is spreading in these areas. But the fact that the community positivity prevalence is 10% is already pretty high, and it's not going to take long for that 10% to become 25% because we've seen this high R value. So we know it's more transmissible. We know there's a fair degree of immune escape, whether you've had the infection or whether you've had the vaccine, you can still get it. We believe that you're going to get a lot less sick if you've been vaccinated and if you've had it, but you're still probably going to, you're going to be exposed, and many people are going to be symptomatic, thankfully mostly minimally symptomatic. But let's look at some proper figures here. So here we have Dr. Richard Friedland, Chief Executive of Netcare. Now, this is one of the big private insurers in South Africa, private healthcare insurers. Omicron variant COVID-19 symptoms are now far milder than in the first wave, according to Dr. Friedland, which is good. Having personally seen many of our patients across Gauteng hospitals, so he's speaking from first-hand experience here, their symptoms are far, far milder than anything we've experienced during the first 3 waves. So we've ended up with this massively transmissible variant that everyone's going to be exposed to. And fortunately, it seems to be producing mild disease. Now, it didn't have to be like that. It's probably more probable that it would be like that. But this could have been like the MERS, the Middle East Respiratory Syndrome, which caused 40% mortality. I could have been sitting here saying, well, I'm afraid there's a 40% chance that we're all going to die in the next few months. Thankfully, I'm not. But it's not because humans have been particularly clever. It's not because the vaccines have been so successful that it's eradicated the infection. It's not because the lockdowns have worked. It's not because we've been so clever. We are just fortunate that this massively communicable variant that is going to bring about huge amounts of herd immunity is doing so at the cost of absolutely minimal disease. Humanity has been indeed fortunate, because this variant could have been associated with extremely increased pathogenicity, as we said, MERS is. And this could have been a disaster for humankind, but thankfully it's not. Thankfully, it's probably going to be the end of the pandemic. But it's not because we've been clever. It's because we have been incredibly fortunate. It's almost as if there's corrective systems looking after us. I don't know how much philosophy or emotion to put into this, but this could have been bad. This really could have been bad, and thankfully it looks like it's not. But anyway, enough of that. Let's stick to the figures and science. Approximately 90% of COVID-19 patients currently in the hospitals require no form of oxygen, according to Dr. Friedland. So 90% don't require oxygen and are considered incidental cases. So about 90% of cases, they just happen to have found that they're positive. They're not admitted for those reasons. This is indeed fortunate. If this trend continues, so of course we do have this proviso. It could be that this makes people sick with a much longer delay. We don't know that yet. It's unlikely. But it's not totally impossible that this variant could make people iller after a month or two rather than a week or two. I don't see why it should be, but it's not impossible. So until the time's passed, of course, we can't give any guarantees. So Dr. Friedland correctly says, if this trend continues, it would appear that with few exceptions of those requiring tertiary care, that's hospital care, the fourth wave can be adequately treated at a primary care level. In other words, people can be managed at home because they're much less sick. I mean, wow, isn't this fortunate? In the first 3 waves, Netcare across 49 acute care hospitals in South Africa treated 126,000 COVID patients, of whom 46% required hospitalisation. Sorry, 44% required hospitalisation. 26% required high care or intensive care. Significantly, all COVID patients admitted were sick and required some form of oxygen therapy. So all of the patients that were admitted in the previous wave required oxygen therapy. In the current wave, approximately 90% of patients in our hospitals require no form of oxygen therapy. I mean, what a relief. Dear me, dear me. The high admission rate, as well as the high percentage of patients requiring ICU or high care is indicative of the severity of cases during the first 3 waves. So the first 3 waves were bad. 44% required admitted to hospital. 26% required intensive care. Virtually 100% required oxygen, whereas now 90%, now 10% require oxygen. Now, again, this is just in this group. This is in this Netcare group. So this is not talking about the whole country. This is the patients he's personally responsible for. 337 COVID-19 positive patients admitted, whereas in the other previous waves it amounted to 126,000. 72% of these patients are in Gauteng area, 18% in KwaZulu-Natal. So still fairly regional. It will be spreading out to all of South Africa. Well, it is now as we speak. So most hospitalisations in these areas. Of the 337 hospitalised, approximately 10% are on some form of oxygenation. Not 100%. About 10% are on some sort of oxygenation. Dear me, that's such a difference. 100% in the first 3 waves. Wow. Aren't we fortunate? 8 out of the 337, 2% are being ventilated, and of these 2 are primary trauma patients. So they were patients who'd had accidents and other traumas, came in and just found to be positive. So we could change that to 6 who actually require it for medical or COVID-related reasons. Incredibly low number. During the first 3 waves, when the overall community positivity rate breached 26% across South Africa, so similar positivity rates. First wave, they didn't have 337 admissions in this particular hospital group. They had 2,000. Second wave, 2,500. Third wave, 3,000. What a difference. Fourth wave, Omicron wave. So far, 337 patients hospitalised. Of the patients admitted to Netcare hospitals and facilities since the 15th of November, 75% not vaccinated. 7 deaths due to COVID-19 complications. So it's not gone away altogether. It's just massively, massively less. Age distribution of patients. COVID-19 patients admitted since the 15th of November are on average younger than those seen during the first 3 waves. 71% being 50 years of age or less. Average age of patients admitted to this particular hospital group, 38.5 years. No question it's younger people, but also no question that vaccination rates are lower in this younger age group in South Africa. Doesn't tell us cause and effect, but those 2 facts are facts. Patient presentation. Mild to moderate flu-like symptoms, as we know. Now, this is different to what we have been seeing, and this seems to develop later, perhaps, because it's not what we have been seeing, but blocked or runny nose. Headache, scratchy or sore throat. Dr. Friedland here doesn't mention the body aches, which we have been talking about. So body aches we know are a feature, but it's not mentioned here. So blocked or runny nose, headache, scratchy throat. Only 10% of people admitted on oxygen. So only 337 as opposed to several thousand admitted, and only 10% of those on oxygen. I can actually feel palpable relief here. This could have been bad, but so far it's looking okay. It is our considered view that at this early stage that this trend should continue. So Dr. Friedland, in the heart of it there, he does admit it's an early stage, but he thinks this trend should continue, direct quotes. COVID-19 may be effectively managed at a primary care level, i.e. by GPs, district nurses at home, with the exception of certain cases requiring admission to a tertiary facility. So the minority, still some people are going to be required. And this is, as I said, this is my concern, that many millions of people in the UK, for example, get it all at the same time. And that could result in a hospital pressure for a short period of time until the herd immunity develops. So that's possible. But we do know that vaccines are providing about a 70, people that are fully vaccinated, we're probably looking at about a 70% protection. Much less than it was, but still a good degree of protection, we believe, from the severe hospitalisations and deaths, as the South Africa data is showing, where we did find out that 75% of patients who were actually admitted to hospital were not vaccinated. Dr. Farid Abdullah, Office of AIDS and TB Research, South African Medical Research Council, he says nationally it's 80% of admissions that are below the age of 50, so even higher nationally. Oh no, sorry, that's throughout the Gauteng province in the last 2 weeks. So that's private and state hospitals in the last 2 weeks. The best indicator of disease severity is measured by the in-hospital death rate. There were 10 deaths in the past 2 weeks from a cohort of 166 patients that he personally followed up. That's 6.6% of people died, but of course that was in the ones that were actually admitted, which were the vast minority. Vast majority of people being treated at home. Now, the death rate amongst people that had been admitted in the previous waves were 23%. So for all previous waves, of all the patients who were admitted, 23% didn't go home. So far, it's 6.6% of a much lower number of admissions. 4 deaths so far, tragically, in the younger age groups, aged 26 to 36. We don't know if these were vaccinated. We believe they weren't. 5 deaths over the age of 60. So younger age group, certainly more at risk, probably because they're unvaccinated. And another sigh of relief, although children have been infected, there were no COVID-19 related deaths among 34 admissions in the paediatric ward over the last 2 weeks. So in the Gauteng area, 34 children admitted. Of course, the vast majority of children that were infected were not admitted, but of the 34 that were admitted, there have been no deaths. So just breathe a sigh of relief on that. It didn't have to be like this. We have been so incredibly fortunate that this is not a bad pathogenic variant, because nothing we've done stopping it spread around the world. It was in England already before we introduced the flight bans. Now, last thing for consideration today. This is interesting, just to get a bit of backup opinion. Omicron variant could act as a natural vaccine. Interesting idea. This is Professor Eleanor Riley Immunology and Infectious Diseases, Edinburgh University, in a few popular press outlets. It was actually on a Radio 4 interview, I believe. Omicron variant could act as a natural vaccine in the unvaccinated. Direct quote from the professor. Britons are very likely to contact the variant in the next couple of weeks. Very likely, direct quote. In the next couple of weeks, direct quote. If you're in the States, as we said, it could be a month or two, but we are all going to be exposed to this variant. I believe virtually all of us. Unless you want to go and live in a cave in the desert or on a desert island somewhere or on a small uninhabited island in the Outer Hebrides, you're going to be exposed to this variant from what we know so far. Everyone's very likely to experience it in the next few weeks. We're hoping that most will be asymptomatic. If it's milder, and we know infection induces an immune response, so if it's milder, and so if it's milder is a question mark, but we do know that it induces an immune response. So does Omicron induce an immune response? Yes. Omicron invokes an immune response, and that's going to give ongoing immunity for a period of time. This could be a natural vaccine. We know that the infection induces an immune response. Fantastic. It is possible that this could act as a natural vaccine, she says, getting to those people who have so far been unwilling to be vaccinated. Interesting. Profound, really. But I think we have to exercise a huge degree of caution with that. Of course, she's a scientist, so she has to hedge her bets on that, of course. Because there's a huge if about if it's milder. But I believe I've given evidence that shows in South Africa it most definitely is milder. And they've had a fair bit of time now for people to start getting sick. Hospitalisations are increasing, but the death rates and the severe illness rates and the oxygen demand are all very low. Yesterday we looked at oxygen demand. South Africa, I got the population wrong yesterday, sorry about that. It's about 60 million, 65 million people in South Africa. And from memory there was about 700, 800 on oxygen who were hospitalised with a positive diagnosis. Many of those who had a positive diagnosis for SARS coronavirus 2 were there for other reasons. The oxygen demand is really quite minimal, thankfully. And I think it's very dangerous to compare data from South Africa to the UK. OK, Professor, fine. Of course, we agree it's just the best guide we've got. In the South African population, there's been so many waves of infection they've gone through. True, but there again, we know that the antibody positivity rate in the UK is about 95%. So it's not as if we're inexperienced or unexposed in the UK. So maybe that's not as dramatic a difference between the two populations as that statement might intimate. Lots of immunity in a much younger population. Well, lots of immunity in South Africa, yes, but there again, a lot of immunity in the UK. 95% people having some form of antibodies, whether it's through natural exposure or vaccination. So we're not an unexposed population, nor is the States. Certainly a much younger demographic in South Africa. That is absolutely true. We accept that. Professor advises to people to act on the basis that anyone they come into contact with could have coronavirus, Omicron, over the next few weeks. So there we are. We're going to be exposed. Personally, I'm trying to optimise my immune system with good nutrition and adequate amounts of vitamin D and some vitamin K2. Hopefully another video coming up on that shortly from the experience in Israel. So that's us for today. We're just going to carry on with a slightly academic debate though. Michael pointed out yesterday that the virus doesn't care if it makes people really sick, because by the time that people die from the virus, the virus they'll no longer be infectious and the virus doesn't care whether they die or not. But we have counter-argument, again, to the counter-argument. This is from Good. You can look him up on the, or her up indeed, I don't know. The first name is Good. It's in the comments. Milder disease will be a positive selection pressure for viral proliferation. Interesting. So what Good is saying is having milder symptoms allow the infected people to be out and about and pass the virus on to more people beyond the household. as opposed to knocking out the host immediately and the virus never getting a chance to get past the immediate contacts. So it's a good point. So if it's milder disease, then people will still be out knocking around with their usual life in the infective period. Therefore, they will be infecting many more people. Therefore, that will be a positive selection pressure for the virus, and in this case for the Omicron variant. So interesting that this is following Darwinian evolution, which sounds very simple in principle, but in actual fact, when you get into it, is quite complicated and more nuanced. But no question that the virus has evolved into the shape of the Omicron. And of course, evolve just means change. The virus has changed from a Delta to an Omicron. In actual fact, the Omicron probably doesn't come from a Delta. It's probably someone infected with another variant other than Delta that became, the genetic material became mixed up with a common cold coronavirus that resulted in the Omicron mutation. But either way, it looks like Omicron might be our way out of this pandemic from what we know so far. Not human beings being clever, but these natural creative processes helping out humanity. And it didn't have to be this way. We are fortunate. Thank you for watching.